This is our series, Presidents and Civil Rights. We are continuing on with Reagan, right? We've been discussing him in our series within a series to address his response or lack of to the AIDS HIV epidemic. Uh, Today, let's start with a conversation about the AIDS HIV epidemic between Reagan's press secretary and a reporter. Yeah, before I forget, uh, you may want to view this particular series within a series on Patreon. Uh, I'm just going to leave it at that. Okay, let's get started. Within the first 5 years of the AIDS epidemic, the White House press secretary, Larry Speakes, delivered the only public remarks about AIDS after several questions about the epidemic came from a reporter. Ironically, Speakes was the only White House official to speak on AIDS. He was the only one. No cabinet member, no president or vice president, no, the press secretary. His answers minimized the disease and reassured the public that AIDS was not a priority for the Reagan administration. I don't know if you call that reassurance. Here's the first exchange between Speakes and journalist Lester Kinsolving from 1982, a year after the first case was identified, when nearly 1,000 people had already been unalived from AIDS. Lester, does the president have any reaction to the announcement by the CDC in Atlanta that AIDS is now an epidemic in over 600 cases? Larry, AIDS? I haven't gotten anything on it. Lester, over a third of them have died. It's known as gay plague. Press pool laughter. No, it is. It's a pretty serious thing. 1 in every 3 people that get this have died. And I wonder if the president was aware of this. Larry, I don't have it. Press pool laughter. Do you? Lester, you don't have it? Well, I'm relieved to hear that, Larry. Press pool laughter. Larry, do you? Lester, no, I don't. Larry, you don't answer my question. How do you know? Press pool laughter. Lester, does the president, in other words, the White House, look on this as a great joke? Larry, no, I don't know anything about it, Lester. Their second exchange was in 1983, when Speakes indicated that Reagan was briefed on the AIDS situation a number of months ago, the first public indication that Reagan was aware of the epidemic. Speakes said that Reagan had not expressed any concern over what was being called the gay plague. By downplaying this epidemic, Speakes echoed the homophobic rhetoric generally shared among far-right conservatives. His consistent belittlement of the disease and those infected aligned with the social conservative ideology of Reaganism. Without transparent and substantial answers about AIDS, the American public was not given the proper context and information about reducing the spread and protecting themselves from the disease. Instead, the Reagan administration's downplay publicly reinforced the insignificance of AIDS to the American public, which deterred domestic pressure to take serious action. Not only was the Reagan administration silent on the AIDS epidemic, they obstructed the work being done to find a cure for AIDS by refusing to allocate additional funding towards AIDS research, prevention, and control. In the early 1980s, Reagan's director of the Office of Management and Budget, David Stockman, targeted public health agencies for massive cuts. Under Reaganomics, funding for public health service agencies was limited, and according to author Raymond Smith, the Reagan administration claimed that the CDC did not need the money and opposed any congressional supplemental appropriations designed to fund the federal government AIDS policy efforts. Journalist Randy Schiltz notes the Reagan administration's reluctance to grant appropriate funding. The spending allocated to public health agencies was woefully inadequate, yet the Reagan administration put forward no new initiatives for AIDS funding. Although a suitable budget for AIDS-related efforts was attainable, the Reagan administration remained committed to reducing domestic spending to fulfill the promises of Reaganomics. Limited federal funding was a popular policy among conservative voters. On September 28, 1982, H.R. 7192, the first legislation to propose to fund AIDS research, was proposed in the House of Representatives by Representatives Philip Burton and Ted Weiss. The bill quickly died in committee. Tomorrow, Reagan himself finally responds to the AIDS HIV epidemic.